Good afternoon, everyone. So first, I will be presenting ProBio Trial. It's an androgen receptor pathway inhibitors or Taxanes for patients with metastatic castration-resistant prostate cancer. It's an academic outcome, adaptive and biomarker-driven trial platform study in the mCRPC. So patients, when planned for a new line of systemic therapy for metastatic castration-resistant prostate cancer, they were accrued and blood collection was done for ctDNA analysis. Patients were randomized to the physician's choice of treatment versus 4 treatment options. One is AR pathway inhibitors, second is Taxanes, third is carboplatin, and fourth is niraparib plus abiraterone. Patients were followed up with a schedule, a monthly follow-up. At progression, patients were again re-randomized to the remaining treatment options. Primary endpoint was progression-free survival. Secondary endpoint were overall survival, safety, and quality of life. Between February 29 to 2022, 343 patients were enrolled. 193 patients were randomized to receive physician's choice in 64 patients, AR pathway inhibitors in 31, and Taxanes in 56 patients. And out of which 77 patients were re-randomized who received AR pathway inhibitors. In 20 patients received AR pathway inhibitor, 19 Taxanes. Moving ahead to the progression-free and overall survival. Overall PFS with AR inhibitors was 11.1 month. Median PFS with Taxanes were 6.9 months, and with the physician's choice, it was 7.4 months. Overall survival with AR pathway inhibitors were 38.7 months, with Taxanes was 21.2 months, and with physician's choice, it was 21.8 months. Moving ahead, against the biomarker signature, the outcomes were compared in the patients who had AR wild type and TP53 wild type. Median PFS was 18.1 months compared to 9.3 and 9.2 months in Taxane and physician choice. In patients with TMP RSS2 ERG positive with AR inhibitors, median PFS was 12.8 months, and with physician choice at Taxanes, it was 6.5 months and 7.2 months. Patients who had TP53 alteration, they have poor outcome with all treatment options, including AR inhibitors, Taxanes, and physician's choice. It was around 6.3 months. To conclude, AR pathway inhibitors, they should be favored over treatment with Taxane in patients with mCRPC with detectable circulating tumor DNA. Superiority of AR pathway inhibitor was driven by patients with AR wild type and TP53 wild type and TMP RSS2 ERG fusion positive disease. TP53 altered disease is a poor prognosis subtype and requires new treatment strategies. Sensitivity analysis yielded similar results. Its outcome adaptive driven design shows feasibility of using ctDNA for the treatment personalization. Moving ahead to the second abstract, biweekly versus triweekly cabazitaxel. In older patients with metastatic castration-resistant prostate cancer, the CABASTY Phase 3 randomized trial. Many older patients, more than 65 years with mCRPC, they are denied taxane chemotherapy because of the unsuitability to treatment. So the objective was to determine whether biweekly cabazitaxel 16 milligram per meter square plus prophylactic GCSF at each cycle reduces risk of grade 3 or higher neutropenia or neutropenic complications compared with the triweekly cabazitaxel 25 milligram per meter square plus GCSF, which is a standard regimen. 196 patients, more than 65 years of age with progressive mCRPC were enrolled between 2070 and 2021. All patients had received docetaxel and at least one novel androgen receptor targeted agent. Patients were randomized 1:1 to receive biweekly cabazitaxel 16 milligram with GCSF versus triweekly cabazitaxel The primary endpoint was to evaluate the occurrence of grade 3 or higher neutropenia measured at nadir and or neutropenic complications. So 196 patients were randomized, 97 patients allocated to receive tri-weekly regimen versus 99 patients allocated to receive bi-weekly regimen. 96 and 98 patients were included in the analysis. Baseline characteristics were comparable in both arms. Median age was 74.5 and 74.6 months in tri-weekly versus bi-weekly group. Performance status, almost 90% of the patient in both arms are ECOG PS01. The site of metastasis, most common site was bone, followed by lymph node, lung, and liver. Comorbidities, almost 30-40% patient had comorbidities in the terms of hypertension, hypercholesteremia, and diabetes. Previous lines of therapy, 28 and 21% in tri-weekly and bi-weekly arms has received one targeted agent. 30% patient in tri-weekly group has received two AR targeted agent, and 24% has received two lines of androgen receptors. Moving to the previous lines of chemotherapy, almost 85% in both the group received one line of therapy. 10% patients have received two lines of prior therapy. 100% almost chemotherapy regimen received was docetaxel. Other agents, abiraterone, enzalutamide, apalutamide, daralutamide were used in previous lines of therapy in some patients. Moving to the results, the median age was 74.6, with almost 92% patient at ECOG status of PS01. The median follow-up duration was 31.3 months. Relative dose intensities were comparable between the groups in the tri-weekly versus bi-weekly, that is 92.7 and 92.8%. The rate of grade 3 or higher neutropenia or neutropenic complications was significantly higher in tri-weekly versus bi-weekly cabazitaxel. It is 62.5% versus 5.1%. Grade 3 or higher adverse events were common with tri-weekly, 72.9% patients versus 56.1%. One patient in the tri-weekly group died of neutropenic complications. This is incidence of grade 3 or higher neutropenia. So in tri-weekly, almost 60% of the 62% patient had at least one event of grade 3 neutropenia, while only 2% patient had the grade 3 neutropenia incidence. So there was a significant difference between the neutropenic complications. Median overall survival in both arms was in both groups were 14.1 months. Median radiologic PFS was comparable, 10.2 months and 7.8 months. Time to response was 4.96 months in tri-weekly and 7.3 months in bi-weekly cabazitaxel. The response rates were comparable in both the groups. So this is overall survival. Overall survival was comparable in both the groups. There was no significant difference. To conclude, in this trial, compared with the standard regimen, biweekly cabazitaxel 16 milligram plus GCSF significantly reduced by 12-fold the occurrence of grade 3 or higher neutropenia and neutropenic complications with comparable clinical outcomes. So the findings suggest that biweekly cabazitaxel should be offered for patients 65 years or older with mCRPC for whom standard regimen is unsuitable. Thank you.